What I'm going to do today is to give you a whirlwind tour of the state of the art and what we know today. I have too many slides, but I'm going to skip probably a number of them, but you're going to be able to get a feel for what exactly is known today. If you need to leave right now, this is a take-home slide. And as you can see, we're approaching nearly 20 million students in colleges and universities. And as one of the speakers already introduced, the notion that we are seeing many more students for help. They are not only the acute problems, but they're very serious problems as well. And we are seeing more students matriculate to college that perhaps when I was college age 35, 40 years ago, or whatever it was, would never have made it to college, in large part because of the advances in psychotherapy and psychopharmacology. So we are now seeing a group of students who are matriculating who probably would never have been able to come in the past. That group, although it's substantial, is by far the smaller in terms of the number of students seeking services, which really happens after they reach the campus. We are dealing with all kinds of things that you will see in a moment, from binge drinking to eating disorders, trauma. We're going to talk about some substance abuse issues in detail later on, but we run the gamut. I will tell you that we had about 10 hospitalizations at Wright State in the last academic year, 5 acute psychotic episodes, first breaks, more bipolar first episodes than I care to count, significant OCD, significant depression, as you can imagine. And I will say some more about that changing patient population shortly. So Richard Cattison, my friend from the Harvard College Mental Health Service, has said that if you look at the last 20 years, you will see that depression has doubled, suicidal behavior has tripled, sexual assaults have quadrupled, and I'll tell you the role that alcohol and substance abuse plays in that. Nearly a half of the students at one point self-report, that is, self-report depression. 10% of the students report suicidal ideation. And a figure that has remained by and large very steady over the last 10 years, 40% to 40% engage in binge drinking, which I will define a little bit later. And so Richard asks, is college the best years of your life? I think they remain the best years, but we have to be alert to certain kinds of challenges. Issues don't start de novo at the university. This is an annual survey, a high school youth risk survey, a reasonably large one, nearly 14,000 students. But you can see from the bullet points on the slide that people before college are struggling with some of the very identical issues that college students are, in terms of the sadness and the hopelessness, suicidal ideation, even to the point of making some specific plan, and about 8.8% had attempted suicide in the previous year. That includes all kinds of attempts, and I'll have more to say about that later. Another organization that I'm very much involved with is the JED Foundation. If you've never heard of the JED Foundation, it's capital J, small e, small d. And this is Phil Satow Foundation that he constructed in honor of his son Jed, who unfortunately took his life nearly a decade ago. They have been at the forefront in developing some standard-wise resources for everyone in the country, and you might want to go on their website and take a look at some of the things. The Transition Year Project is about to be launched shortly. I'm on that consulting board, and it really recognizes the issues in that last slide, namely that there is a transition. It's not all the minute you start walking onto the campus in your freshman year. So I urge you to take a look at that. They are going to have a number of different initiatives as part of this program to raise awareness. And if you saw the Huffington Post on March 30th, you will have seen the column by my friend Harold Koplowitz, who used to be at NYU, with the unfortunate title, Has Your Child Been Accepted to Suicide University? What he was referring to, since nobody believes there's any part of the country beyond the Hudson River, he was referring to the 5 suicides at Cornell in the last year and the 3 at Yale. And so the Huffington Post presented this issue, and Howard talked about what kinds of things parents should do. This requires preparation, and every year in the summer I do get a lot of calls. How can I ensure the continuity of care for my son or my daughter? And as he argues, preparation is very, very critical. Do not wait till the last minute. The role of the college in supporting it, and teaching their sons and daughters to be the advocate for what they need with respect to mental health care. And that includes not only counseling and medication, but it also includes disability kinds of services for specific learning disorders as well. And you need to know whether or not your child will be able to be covered for mental health services. It's simply impossible in this day and age to be able to provide all the services that are needed on campus, and so frequently students must go for long-term care into the community. And they don't accept students gratis there. And the issue of hospitalization when it's needed, most student insurance policies do not cover mental health admission to psychiatry services. All of these things parents need to know about before their kid goes to school.